Admittedly, when I think about cancer treatments, I do not think about a rehab program, but it makes perfect sense. Here to explain that is Audrey Stockwell. She is the ReVital Cancer Rehab Program Director for KORT Physical Therapy. Audrey, welcome back to the show.
Thank you.
You're very excited about this. So first of all, I don't think it's uncommon for people to go, okay, how does rehab and cancer treatment work together? But after you and I've had a brief chat, it makes perfect sense. So what can a rehab program do for someone who is living with cancer?
Absolutely. No, thank you. You're right. They don't seem to go hand in hand. You know, you think of having a knee replacement or shoulder surgery and you automatically think physical therapy or rehab. But after a cancer diagnosis, it doesn't always appear so obvious, but it should be. And this is because oftentimes after patients have a cancer diagnosis, they go through rounds and rounds and rounds of treatment. That treatment could be surgery. That treatment could be chemotherapy, could be radiation, could be hormone therapy, immunotherapy, but all those treatments have side effects that take a toll on the body and the mind. And physical therapy can be there to actually help improve function, quality of life, and prevent a lot of those side effects that those treatments can have. So many of those side effects can really impact somebody's function and quality of life, such as fatigue, weakness, they lose strength, muscle and joint aches, surgery that restrict motion, mobility. And then think of the mental side effects. So thinking about, a lot of people think of chemo brain or brain fog, but a lot of times we can help with many of those side effects and get people back functioning the way they want to function.
Yeah, I think we all hope that any of our friends or loved ones never have to deal with the word cancer. But if they do, I cannot imagine how frustrating it would be, because suddenly you not only are you physically limited, but as you mentioned, mentally limited. Mm-hmm. So with this rehab program, and I could see where it could help a lot of people. So when should someone start? If they're diagnosed with cancer, when should someone start a program with KORT?
Yeah, honestly, as soon as possible. And I know that a lot of people don't think that way. You know, oftentimes, you know, when you have that cancer diagnosis, there's a lot of anxiety that goes along with it, trying to sort out medical appointments, trying to sort out what's the next test I have to get done, when do I have to get all these treatments. So the thought of trying to put in one more appointment is often overwhelming. But I will tell you that this appointment is probably going to be the one that can help you pave that path for a much better quality of life and help calm you while you're going through those treatments. Having these appointments and consultations with that physical or occupational therapist can help you make a plan for how you stay on track during your treatments. And it's not your typical, you know, when you think of physical therapy after surgery, it's not your typical 3 times a week. It's typically just checking in and making sure you're staying on point and giving you the tools that you need to stay as active and stay how you need to be, whether it be working, playing with your kids, whatever you need to do during your treatment, and stay on course.
Yeah, Audrey, I would think this probably goes without saying, but I think it's important to point out, you just don't want to go to a regular rehab program. You want to go to a program that KORT has, that you direct, that really specializes in this, because there's a lot of nuances about cancer and things that they will suffer through, someone who is living with it, and hopefully you can help them get over the challenge. I don't want to say with ease, but with more efficiency, so that you can live that life, that abundant life that we all want, right?
Absolutely, yeah. And you know, when you look at you know, what physical therapists go through on their training, and it is a very rigorous training, physical therapy school, occupational therapy school, but we don't get a lot of cancer rehabilitation training in our baseline training. So you want to look for cancer rehabilitation specialist, if you will. So somebody who's gone above and beyond in their training to understand the medical management of cancer. So they understand what chemotherapy drugs and the side effects are. What are the side effects of radiation? What are the special side effects that you need to look for cancer surgeries? Because that person's then going to understand how to take an individualized approach to your treatment and how to make your therapy important to you, and how to make it specific to you and make it safe and effective for you while you're going through your treatment.
Audrey, how new is this? Because I would think there's been a need for a long time, because if you've ever seen a loved one who maybe beforehand was very physical and very sharp mentally, and suddenly, you know, cancer hits and it changes everything, these treatments are pretty, take a toll on the body and mentally. So how long has this existed? I could see why it's so important, and I would think that if someone's aware of it, they would right away say, okay, let's make sure we get you in rehab so we can bring you back to your old self again, right?
Yeah. Well, you know, honestly, John, it's been around for a while, but it's just now, there's just now research and evidence that's coming to light that's showing its efficacy. So doctors, providers are just now realizing that it's becoming the standard of care for patients with cancer. So not every physician, not every provider is starting to recommend this on the front, but they're starting to. So I would say if you are a patient that has been diagnosed with cancer or your loved one has, to ask for this service, to ask about it. Ask your doctor if this is recommended, because it's not the norm yet, but it's getting there.
Okay, so you know what question's coming next is that is it covered by insurance? Because I think a lot of people say, I'd love to have that advantage, but is it covered?
Absolutely, and it is, and that's the good news. You know, cancer is very expensive. That's the other thing. You know, when you think about all the treatments that everybody has to endure, everybody's worried about money, and it is covered by insurance, just like any other physical therapy treatment. It's subject to deductibles and co-pays, but the thing is that when you are going through treatments such as surgery and chemotherapy drugs and things like that, the good news is a lot of patients meet their deductibles and things like that. So the physical therapy or occupational therapy co-pays end up a lot of times being they've met their out-of-pockets by the time they come to us.
Audrey, I would think, you know, we can talk about the physical side, and certainly that exists. We know how much chemotherapy weakens someone. If you've ever had a loved one go through this, it's horrific. But I think the mental side, not only with helping out with brain fog, but the fact of knowing that, you know what, I'm making progress, I'm getting better, and that positivity, and I use the word snowballs, but it does snowball, isn't it? Because it's been proven the mind and the body are connected. So you start getting better and you're feeling better about yourself, and I am improving, it can help out the physical outcome, the actual outcome, right?
Absolutely. I've had patients tell me that this is the one appointment that they look forward to coming to, because this is what we do actually empowers them to make a choice. Everything else when they're going through cancer treatment is out of their control. They're being told to take this medication. They're being told to undergo this surgery, this radiation treatment. But everything is out of their control. This is one thing that they can control. They are in charge of being able to control their body in this way, where they can do this exercise to make them feel better. They can do this activity to make them feel better. And coming to have somebody else to experience that with and have that positive outlook is such a game changer during a treatment like this.
I think it's fascinating, and now you've helped me out. I understand the association, and it makes perfect sense to me. So where can our viewers go for more information if they're saying, I want more information, this is pretty exciting?
Yeah, absolutely. So our website, which is KORT.com, or you can call us at 645-5346. Thank you.
Audrey, thank you very much, Audrey Stockwell. So there's good news for you. There it is, KORT.com. Go there and learn all about cancer rehab. It could be very valuable to a loved one who may be suffering with the effects of surgery from cancer. Of course, we all know about the treatments and how they can affect you. This is good news. Okay, coming up, speaking of good news, we're not going to let it happen to you. Don't go broke in a nursing home.